And how are we going to fix it? Well, this is based on our description of the hernia and their past surgical history. Their surgical history dictates whether this is an initial repair or a recurrence. If they've had previous hernia surgery, then that's a very important factor, and that leads to an increased risk of recurrence as well. That will also dictate if they had previous dissection in which plane, or if they have existing mesh. These are things to consider on planning your options for the repair, whether you're doing it MIS or you're doing it open. Other factors that you have to control for are surgical site infection and previous infections that need to be covered or eradicated. Let's say you had a patient with VRE or MRSA. So we want to make sure there is eradication of that infection prior to surgery, and you want to make sure that you also cover for specific antibiotics. Most antibiotics for clean cases would actually land us on a first-generation cephalosporin. However, if you have a specific wound infection that has been identified, you want to make sure that your antibiotics is tailored to cover this type of wound infection.